Okay, I posted this on Instagram last week, and loose skin was the reason for doing a tummy tuck to remove loose skin and stretch marks with Lipo360, and her 6-week post-op. I got comments on this scar. Even a surgeon from Europe giving me a thumb down, telling me that this was a terrible scar at 6 weeks. I post those pictures intentionally because I think it's important to see what things really will look like, and I like it to look like it does. There's eversion of the scar with the skin edges raised, and we know from literature and a lot of work done in science on wound healing over the years that this will give us the opportunity for the finest possible scar. Here's a review article, the end of 2016, looking what does the evidence say in terms of how scars will optimally. This is an evidence-based study. What does the evidence show? It shows that for preventing scars initially, topical silicone, tension reduction, and wound edge eversion have high effect. Onion extract, lasers, garment massage. For primary scars, do not. And for hypertrophic scars that we end up with, meaning those thickened, bandy scars, lasers, injections, and scar massage, as well as topical silicone, all show a good effect. We do regularly recommend massage because it does help soften scars, and if you do end up with more of a hypertrophic tendency or thickening of the scar, it will benefit that. So we recommend that routinely. Superficial fascial system within the fat layer. This was an article from nearly 30 years ago that really taught us a lot conceptually about how we can additionally support the deep tissues to get better lifting and relieve tension on the incision line to improve scars. Picture from the article showing the pickups there on the fat layer, but the strong fascial layer dividing superficial and deep fat. This is the basis of that superficial fascial system, an important part of our closure. I show this a lot on our snap stories during surgery, but there's a superficial layer and deep layer of fat. Often that deep layer of fat is what I'm cutting out with tummy tuck. Why is this important? Well, that eversion of the skin prevents what we see here, some depression of the scar that can lead to widening of the scar and an inverted or a depressed area along the skin that is more noticeable. I talked about silicone being helpful scars. This biocorneum dries as a film. It's been FDA approved for that purpose. And then Embrace is an actual external scar application that takes tension off of the skin. The gold standard is a randomized controlled trial. So here's a randomized trial on the Embrace device in scarring. Technically, this is applied as an external silicone medical grade film that is applied under tension, so it relieves tension on the scar line externally. One example of where not treated or the control and treated, not treated, treated, same person, and differences in the scar. All right, another comparison including a close-up using not treated or control, Embrace treated, and it makes a significant difference. If you're otherwise going to have a very fine scar, Embrace may not improve that, but if you're tending towards unfavorable scarring, Embrace very often will make a very significant difference in the scar, added to all of the other techniques that we use to minimize the scars. Table from the study with blinded observers to scars showing a significant better scar or lesser scarring on the left versus a control or untreated with Embrace. Okay, let's get the phone back to vertical here. And short version of this is stretch marks within the scar are not something that we can control for, and they do tend to pleat more. That generally will settle down, but not always. Bottom line is I love this scar. 6 weeks, it's nicely everted. That definitely flattens. It avoids that depression, takes tension off the skin, together with progressive tension sutures that have taken tension down to relieve tension on the skin, and closure of that deep superficial fascia system for additional tension relief. This is the optimal setting for improving the scar.
Hey guys, it's Brianna. We have a post-op patient here who is getting the Embrace today. It is her 3rd application, and she had a brachioplasty. You can see the scar on her arm here, and that's what we're using the silicone-based Embrace to help heal that scar. And also, we don't want to contaminate it because it is going on the patient's skin. We're going to start by pressing it on the edge of the scar and line it up. So we have the Embrace applied, and this will stay for about 10 to 14 days. She'll let her skin air dry for 24 hours and then come in for another application.
Closing in multiple layers, and you can see how nice and thin things are. I've thinned out and done some lipo on this lower flap as well as how thin that upper flap is. You know, it's really about a centimeter thick. And I'm closing, taking tension off like the first layer of those progressive tension sutures we just placed, and 3 additional layers of suture. And I'm intentionally working to ridge up the skin. I get a lot of comments on Instagram, other places, hey, it's an ugly scar, it's all ridged up. Dr. So-and-so and how pretty their scar is. Well, no, this is intentional. There is excellent data to support that when we ridge up and take tension off the skin, it for sure flattens. I can tell you that with certainty, and it gives us the finest possible scar. So I'm setting up for the finest scar that our body can give us. Varies person to person, but that's a technique for closure.